My name is Bryana Workman.
And my name is Jenna Ruiz.
And we're from Miss Llewellyn's Biomed class.
Today we're going to be covering LDL and HDL. What is LDL and HDL? LDL is low-density lipoprotein cholesterol, commonly referred to as bad cholesterol. Elevated LDL levels are associated with an increased risk of heart disease. Lipoproteins, which are combinations of fats and proteins, are the form in which lipids are transported in the blood. LDL transports cholesterol from the liver to the tissue of the body.
HDL is also known as high-density lipoprotein cholesterol. HDLs transport cholesterol from the tissue of the body to the liver, so the cholesterol can be eliminated in the bile. HDL cholesterol is therefore considered good cholesterol. The higher the HDL cholesterol levels, the lower the risk of coronary artery disease. An HDL cholesterol of 60 mg or higher gives some protection against heart disease. Exercising, loss of weight, and cessation of cigarette smoking also increases HDL cholesterol levels. How do LDL and HDL differ structurally and functionally? The main structural differences between LDL and HDL is their compositions. Approximately 50% of the weight of an LDL particle is cholesterol, and only 25% is protein. High-density lipoparticles, on the other hand, consist of 20% cholesterol by weight and 50% protein. Other major structural differences between LDL and HDL results to the type of protein they contain. LDL contains protein called B100 proteins, while HDL particles mostly contain A1 and A2.
The functions of LDL and HDL are that they both transport cholesterol in the blood, but the main function difference between the two is they deliver cholesterol to different parts of the body. LDL, the primary carriers of cholesterol, bring cholesterol throughout your body and can cause cholesterol to build up within your arteries. The buildup can eventually lead to arterial blockage and increased risk of heart disease and stroke. HDL, on the other hand, benefits your health because the particles carry cholesterol away from your heart and other organs and deliver it back to your liver, where it is passed from your body. Why do doctors monitor the concentrations of LDL and HDL in a patient's blood?
LDL and HDL are both monitored along with other things because they are used to help evaluate the patient's risk of heart disease. Whether more cholesterol is being taken to or from the cells is determined during a blood test. HDL levels should be at least 40 mg or closer to 60 mg. LDL should be lower than 129 or even lower for people that are at high risk for heart disease.
How are the concentrations of LDL and HDL associated with the risk of heart disease and associated disorders?
An excess of LDL can result to plaque buildup on arterial walls, which can ultimately result in atherosclerosis. That is the hardening of the arteries and can lead to heart disease like heart attacks or strokes. Unlike LDL, higher HDL levels can actually lower the risk of heart disease.
What other molecules in the patient's blood are monitored along with LDL and HDL? Why? Triglycerides, cholesterol, LDL, VLDL, and HDL are monitored. Triglycerides are a type of fat the body was to store energy and give energy to the muscles. Only small amounts are found in the blood. Having high triglycerides and high LDL cholesterol increases heart disease more.
Cholesterol. The body uses cholesterol to build cells and produce hormones. Too much in the blood can build up inside arteries and form what is known as plaque. Large amounts of plaque increase your chances of heart attack or stroke. VLDL contains very little protein. The main purpose of VLDL is to distribute the triglycerides produced by your liver. A high VLDL cholesterol level can cause the buildup of cholesterol in your arteries and increase your risk of heart disease and stroke.
So why is this done? This testing is done because it is a part of a routine to screen for lipid disorder, to check your response to medicines used to treat lipid disorders, to help find your risk of having heart and blood flow, including your heart attack and stroke. Also, if you have unusual symptoms such as yellow fatty deposits in the skin, which may be caused by a rare genetic disease that causes very high cholesterol levels. What do the results of a cholesterol test mean? How do patients interpret each value?
Your test report will show your cholesterol levels in milligrams per deciliters of blood. To determine how your cholesterol levels affect your risk of heart disease, your doctor will also take into account other risk factors such as age, family history, smoking, and high blood pressure. Blood cholesterol levels are measured in a small sample of blood taken from a prick or from a vein in your arm. The blood is If you have a lipoprotein profile, it's important to look at all the numbers from the cholesterol test, not just the total cholesterol numbers. That's because LDL and HDL are two primary indicators of potential heart disease.
What can patients do to change the levels of LDL and HDL in their blood?
Several things can be done to change the levels of both LDL and HDL in your blood. A healthy diet with reduced fat and cholesterol will increase HDL levels and decrease LDL levels. Saturated fat intake should be limited to 7% or less of total calories. Cholesterol should be 200 mg per day or less. And omega-3 fatty acids will increase HDL levels. It has been found that physical activity can rise HDL levels 5%. The activity needs to be consistent with at least 30 minutes a day for at least 5 days a week. How does intake of unsaturated, saturated, and trans fat affect cholesterol levels and overall health?
3 main types of dietary fat exist: unsaturated, saturated, and trans. Monosaturated and polysaturated are the healthy type of fat that improves cholesterol levels, decreasing risk of heart disease. Monosaturated fats promote better sugar control and insulin levels. Polysaturated fat can lower your blood pressure, protect you against regular heartbeats, and lower your risk of type 2 diabetes. Saturated fat is a type of fat that comes mainly from the animal products. This type of fat is unhealthy for your body and may increase your risk of type 2 diabetes. It may also increase your risk of heart disease and by increasing your LDL. Trans fat is the most unhealthy type of fat. Trans fat can increase your LDL and decrease your HDL, which increases risk of heart disease. Inflammation in your body from trans fat can cause risk of cardiovascular disease and type 2 diabetes.